growing up, had always thought that I was actually going to go into business. My college applications were due very soon, and I was just chatting with a teacher of mine in high school, and he said, "Hey, my wife's going into nursing. So I'll just put nursing down." And I fell in love with it. Nurses are both powerful in the things that we say and our knowledge, but perhaps don't always have the biggest platform to project that to the world. Ended up getting my first offer with the neuroscience ICU.
What are some things that you wish more people understood about brain health?
That it doesn't have to be scary. I wish people were willing, and I wish providers were willing to confront the issue head on. I think we have to continue to push neuroscience out there so that people stop getting scared of it. Because nurses have the ability to talk to patients in a way that is meaningful. We are a trusted and valuable source of education and information within the healthcare system. And I think we've sat back for too long. We're changing that trajectory of nurses educating the population. And we are the experts. And I think that we're not afraid to say that anymore. I care about my patients. And so if I care enough, I'm going to have to put myself out there.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hey guys, welcome back to the Nurse on Purpose podcast. Today's guest is somebody who brings brain power in more ways than one. I'm joined by Katie Archer, a neurosurgery nurse practitioner based in Louisville, Kentucky. Katie started her journey in the high-stakes world of the neuro ICU and has since built a powerful career blending clinical expertise with education. With her CNRN certification, which is her Certified Neurosurgery Nurse certification, and her years of bedside and academic experience, Katie has become a passionate voice in neuroscience nursing, sharing her knowledge from local classrooms to national conferences. She's also part of the dynamic Ask the Brain Nurse team, working to make neuroscience education more accessible, engaging, and empowering for nurses everywhere. Katie, it's such a pleasure to welcome you to the podcast.
Excited to share with everybody.
Thank you. Thank you for being here. Neuroscience, that's like such a sexy department.
We like to think of it as so, yeah.
Yeah, I mean, what inspired you to go in that direction? First of all, talk through your nursing journey. How did you kind of become a nurse? And then how did you go into neuroscience?
So my journey to nursing is not the classic journey. I, growing up, had always thought that I was actually going to go into business. And yeah, it's what everyone says. And then I took one accounting class and hated it and knew it wasn't for me. So I had to kind of quickly pivot to something else. Yeah. My college applications were due very soon, and I was just chatting with a teacher of mine in high school, and he said, "Hey, my wife's going into nursing." And so I looked a little bit more into it and was like, oh gosh, college applications are due in a week. So I'll just put nursing down. And then I fell in love with it. I took my science classes and then I got into nursing and I was like, holy moly, this is awesome. It kind of combines the things that I love. I like science. I like thinking deeply about things. But I also am an empathetic person. I enjoy being there for somebody. And so nursing kind of married those things, and it was just a happy accident that I came into it. So it was great.
I love that you talked about those two, the empathy and the science, right? Because it is both an art and a science. And we don't see that science reflected as much as we see the art, the compassion, the caring, the bringing value, giving dignity, and all of those things that nursing also encompasses, but also the science. So that's a wonderful story. 1 week, 2 applications. Like, I better pick something.
Just kind of happened into neuroscience.
Yeah.
I was doing my final rotation in nursing school in a trauma ICU at a level 1 trauma center and loved it. And so I knew I wanted to work ICU. I know there's millions of people out there that are like, nurses should not first go into ICU, and
Yeah.
that was
Yeah.
not my path. But I applied. I kind of blanket applied, and I knew I wanted to work a level 1 trauma center. So I applied at my city's level 1, and kind of every ICU, I just put an application in, and
Wow.
I ended up getting my first offer with the neuroscience ICU. And so, and got into it and met some of my best friends in the world there and took care of just wildly sick patients and loved every minute of it. But my orientation was tough. It's a sick, kind of sad population sometimes.
Yeah.
We have rough outcomes, and so I really was young. I was 21 and did not know how I was going to emotionally cope with it. And so 3 months of orientation, and then honestly, I was 2 weeks off orientation, and I bought a book to study for my master's program. I bought a GRE prep book because I was like, I can't do this.
Yeah.
And so I started studying for my GRE, and then I just put the book down. I was like, no, like you can do this. And how I discovered the passion and the ability to do it, I went head first. I learned everything I could. I involved myself in every physician rounds. I got involved in councils. I did all the things so that I could be the best nurse that I could, even in a challenging setting. And it was like those years as first being a nurse that I was able to realize how powerful educating is. If you have an education in something, whatever it is, then you can take something that feels uncomfortable and make it comfortable. So it was then that I learned, like, yeah, you can do hard things. You have to teach yourself how to do it. And so I worked as a bedside nurse in the neuro unit for 6 years, and then went back and got my master's. And so I'm now a nurse practitioner and have been, and even then, so I graduated with my nurse practitioner and thought, boy, neuroscience is hard. I applied for a stroke job and then honestly redacted the application because I just wasn't sure.
Yeah.
So ended up doing random things. I ended up going into GYN for a little bit, and then GI, and got recruited back to the same level 1 trauma center with neurosurgery that I started out with, and that was 7.5 years ago, and haven't looked back. So lucky is really how I describe my career. So I have gotten lucky.
Yeah, because that is not the conventional path. A lot of new nurses are not getting into neuro units or ICUs for that matter. So you found your call, your calling found you, I guess. And it's just been that journey ever since. But I love that you blend your love for education with your love for neuro and neuro patients using this platform called Ask the Brain Nurse. Can you talk to us about, Ask the Brain Nurse? What inspired you and your team actually to found this group?
I was able to meet this team of amazing, like-minded nurses who were also passionate about education and the impact of a nurse's voice. We understood and still do that nurses are both powerful in the things that we say and our knowledge, but perhaps don't always have the best or biggest platform to project that to the world. And so we at a meeting sat down and we were like, what can we do? How can we take the knowledge and the passion that we have and share it? And what platform should we do that to? And so we, all neuroscience nurses, we all get that neuroscience is sometimes really scary and sometimes really intimidating, and to both patients and providers. And so we really wanted to emphasize that we can make this relatable. This doesn't have to be a scary thing. And And we know that when our patients are able to advocate for themselves and are educated in their disease process, their outcomes are better and their disease process is better tolerated.
Yeah.
And so how could we do that? So we had a think tank and created Ask the Brain Nurse. So it's only a few months young and growing, but we love it. We take what might be complex or difficult topics, traumatic brain injury, Parkinson's, essential tremor, and epilepsy. And we make it relatable with terms that the general public understands. And how can I take that to my provider so that I can be heard and understood in a meaningful way? And that was what we wanted to do. And I hope that we're accomplishing that and we're going to keep growing. But yeah, we've got some powerful nurses that are hoping to change our patient population. So
That's amazing. Can you talk about some of the more common conditions that you address, or even some of the uncommon ones, like the ones that people don't know about or don't think is a neurological condition that you guys tackle on your platform?
So we do things that are incredibly common. Concussion, words like traumatic brain injury are very scary, but we hear things like concussion all the time. And so what does that look like in real life? And how is that relatable? We see it every day, right? You see it with your football players and there was an incident not too long ago where there was somebody celebrating after their team won and they had a concussion. And so what does that look like on the science side? And how can we make that relatable? And so that's something we certainly addressed and talked about. A few months ago, I did a topic on something called normal pressure hydrocephalus, which is actually very, very common, mostly in our elderly population. But the unfortunate thing is that the most common symptoms with that are patients are wet, wobbly, and weak, and so, or wacky. And so, they're a little bit confused. And so, if you're older, sometimes people say, oh, grandma just is confused, she's tired or whatever. And they have some urinary incontinence and they're like, oh, that just happens with grandpa's prostate. And so, but this is an actual condition that we can make huge improvements on patients' lives if they know it exists. And how often do you go to your provider and you think, I'm not even going to bring it up because that's a normal part of aging.
Right.
So it doesn't have to be, and these are huge quality of life indicators. If you don't feel like you can leave your house because you might have an accident or you might fall. And so, those are the things that we want to highlight, that these are common, and let's talk about it and how, one thing with the brain is, people classically feel like brain surgery is end of the world, right? We had brain surgery and you never came back from it. When the brain touches the air, it's bad, right? But that's not the case. People will go home literally the next day and have a completely different change, a different outcome, quality of life. So.
Yeah. Wow. First of all, as you were talking, I'm like, what platform do you guys stream on? Where people, because I usually ask that at the end, but I'm like, I need people to know just in case they want to leave like midway through our conversation and go find
we're on Facebook and Instagram right now. So,
Instagram.
And we're simple, Ask the Brain Nurse.
Yeah. What are some things that you wish more people understood about brain health and neurological conditions?
That it doesn't have to be scary. It is, it's, and what I tell patients a lot, and I had this conversation earlier today with a patient, we literally did brain surgery yesterday and she's going home today. And she was like, I didn't know it could be that way.
Right.
And it was an epilepsy surgery. Her life is going to be changed. She will be able to work and to drive and to do these things now because hopefully she'll be seizure free and she's young. And so I wish people were willing, and I wish providers were willing to confront the issue head on and to address it. Things don't have to be the status quo. There has been so much advancement in the last 10, 20 years that the conversation is completely different. And so I wish and want people to understand that it doesn't have to be a scary topic. And we want it to be approachable.
And just demystifying it, right?
Yes.
It's
Yeah,
like there's
absolutely.
even among healthcare providers, like
Yeah.
there's this dread associated with like
Mhm.
neurological conditions,
Yes.
neuro in general. We're so afraid to talk about it or even treat or manage it.
Yeah.
We automatically assume, like, oh no, this is hands off to this, like it's beyond my pay grade. But how can we get rid of that? I can't even call it a stigma, but how do we get rid of that perception and that mindset? It's
And I
not
think it
scary.
goes back to education and exposure.
Hmm.
We have to look deeper at the topics
Yeah,
and realize that these things are impacting our patients' quality of life in immeasurable ways.
yeah,
And if we are serious as healthcare providers and caregivers to make an impact on our patients' lives, we owe it to them
yeah,
to educate ourselves on this so
yeah,
that we can appropriately advocate for them to get
yeah.
better.
Can you share like a story of maybe a time when your content helped somebody recognize symptoms or seek medical care just in the past or more
Yeah.
recently?
Yeah. So I wrote a piece, and it was just a little blurb about I work with a surgeon that does functional things, and so we do a lot of surgeries for Parkinson's. And essential tremor, but this piece was specifically about Parkinson's, and it got released out. It was just a hospital wide thing, and then and honestly, didn't have a clue if anybody even read it.
Hmm.
And then I had a nurse come up to me in the hallway and he said, my mom has Parkinson's.
Oh, wow.
And I didn't, and he's like, it's not terrible yet, but she's maxing out. She's getting to the, kind of the end of her medical management. And he's like, I want to know more. Can you tell me more? Can you sit down with her? What does this look like? And because again, it's brain surgery and people get intimidated by it.
Yeah,
And
yeah,
so, and he didn't even know this was an option because whoever is managing her Parkinson's right now hasn't addressed that with her either. And um, so that was a direct impact to somebody I see every day who knows me.
yeah.
And he didn't know that this was an option for his mom. And so
Wow.
to me, I'm just like, man, if I can meet somebody like that here in my hospital, like who can watch Ask the Brain Nurse and be impacted?
Mm,
How can we change lives with this platform? And I think it's happening. It's going to continue to happen.
mm,
I really see positive change with this.
yeah. That is so deep and interesting. And we even, have a saying about it, like, it's not brain surgery,
Right.
like, and that
Yes.
exalts brain surgery to this level of like, understanding that
Mhm.
a layperson cannot have, right?
Right.
And so that makes sense why a lot of people are kind of worried about that. But just like you mentioned now, I didn't know either that Parkinson's, there was surgery that could be performed for that. I didn't know that. I thought it was just medication management until whenever that person's management would run out. But are there any particular neurological topics that, just like this, you feel deserve more public attention and awareness about?
I think, and I won't continue to talk about movement disorders, but I think that is certainly one that requires more public education because it has
Mhm.
such a big impact on quality of life.
Mhm.
When patients no longer can eat because their spoon shakes too much,
Mm,
they their quality of life is impacted too much. And
mm,
so there's a lot of missed opportunity, I think, in that field. And then I think the other one, and this is my personal bias, but you could ask 10 people and they might give you 10 different answers.
mhm,
But the other one, in my opinion, is concussion. I think concussion
mm.
touches so many people of all
Yes,
ages.
yes, yes.
And I think that we do a kind of average job at
Mm.
communicating the long-term sequela of
Oh,
concussion.
wow. So
And
good.
so, yeah,
Mm.
so I think that, people, providers, caregivers can really, by educating themselves on what that looks like long term,
Mhm,
um,
mhm.
can provide a lot of support to the patients that have a concussion.
Wow.
A lot of folks don't even seek concussion treatment. They get knocked out during a game, a sport, a slip and slide kickball, whatever it is, and they're like, oh, I'm fine. I'm going to sleep it off.
No.
And that it doesn't have to be that way. There's a lot of good, and it doesn't mean you're going to get held hostage in a hospital. You just, maybe there's some neurocog rehab that we can provide that will get you back to work sooner, get rid of your headache sooner, just manage those symptoms. You don't have to be hospitalized. You don't have to have surgery. It's just, there's things that we can do. And I think that that's one area that I wish was highlighted more within the neuroscience realm.
I need to connect you with a friend of mine, because let me tell you this story. A friend of mine recently, her daughter, who is, I want to say she's 16, got involved in a motor vehicle accident and suffered like really severe TBI, concussion. And she's been dealing with pains for a long time. And as you were saying, sequela, the reason why I said wow and I exclaimed was because now she is unable to do a lot of the activities that she truly loved. Like she would swim every day because she has a pool at home and she's a competitive swimmer. And now she can't swim. So she is now feeling depressed. She's now feeling like fatigued a lot. She is kind of anxious too, right? So there's so much going on because of that motor vehicle accident, of course, that she's getting anxious to go back on the road and things like that. But the concussion and the headaches that she's been experiencing have been so debilitating. And this is a young girl who is, in the prime of her youth. She's in high school or whatever. And how that has really affected her life is beyond what I would have expected from what they called whiplash, right? So just being able to teach people these things and understanding that it's not abnormal and it's not unusual for symptoms to linger way beyond the event, I think will free up a lot of people's mindsets and really help them to seek that treatment that they're kind of neglecting, thinking, oh, it's not a big deal, it's just a headache. Like, who knows what else is going on? Who knows what nerve is compressed? Like, who knows what you're dealing with that you could be seeking help for? Thank you for using this platform to really educate the public, right? It's important work that you're doing.
Sometimes you just need to hear that what you're going through is normal. And we can help. It doesn't have to be this way, and it's not going to be this way forever. So, let us help you. And if the person that you're talking to doesn't or can't understand that, then get a second opinion, because there are other options out there. And I hope that our platform empowers people to do that, to know that, Katie with Ask the Brain Nurse says that this is a real thing. And just because you may not see it, or just because maybe you're intimidated by it, doesn't mean that it doesn't devalue my symptoms and my feelings. And
that's right. That's right. And now I want to move into something that I'm very passionate about, which is nurses like really stepping into this educator role, right? And we've been talking about it here with Ask the Brain Nurse, but we know that historically physicians have led public education in healthcare, particularly in really specialized fields like cardiology, neurology, and all other ones. How do you see nurses stepping into this role more? How can we push for more recognition as being experts in educating patients here?
Yeah, I think for me, one thing that really helped me find my voice in educating in neuroscience was getting my certification. It made me, maybe I had all the knowledge there inside, I don't know, but once I had this certification, I was able to really feel like I did know, and I maybe I knew it all along, but I don't know if there's something about nurses that something in our DNA is just like we'll let them talk, and
oh my gosh, I love that nursing has a DNA.
Yeah. And so I think for me, that was something that was really, really powerful to me. It validated the fact that I did know what I was talking about, and I could do it. And then putting it into action, practicing it. Sure, I knew all along, but then I became the translator for the neurologist, the neurosurgeon, the critical care attending. I was the one at the bedside that was there in rounds, and I was like, yep, I'll have to come back. And then I would go in the next room, and then I would go right back, and I'd be like, okay, did you actually understand that this is what they said? And then I would, I'll pull up their picture on the screen, and then we go through it. And I'm like, and this is why you feel this way, and this is why things are good or bad or whatever it is, and so I literally feel like the medical interpreter for these patients because nurses have the ability to talk to patients
Yeah.
in a way that is meaningful. We
Right.
can translate this jargon
Yeah.
into something that makes sense. And
Yeah.
so I think for me, anyway, I guess to answer your question, I think that was what kind of gave me the confidence to do it. Everybody's different, sure,
Yeah.
but it just takes some time. I think we have to continue to push neuroscience out there so that people stop getting scared of it.
Yeah, for sure. And how do you think like nurses being at the forefront of patient education changes the way the public perceives our profession?
I think we have to. We are a trusted and valuable source of education and information within the healthcare system.
Yeah.
And I think we've sat back for too long.
Yeah.
We have accepted for whatever reason that someone else can talk.
Yeah.
And I think it's time, and I think, and we're definitely on that shift, right? We're changing that trajectory of nurses educating the population, and we are the experts, and I think that we're not afraid to say that anymore. And I think that for whatever reason, I have my reasons, you have your reasons, but we're not going to sit on the sidelines anymore, because we've seen healthcare and we've seen the outcomes, and we're like, this isn't going to cut it. I care about my patients, and so if I care enough, I'm going to have to put myself out there. I have to step up. I have to educate.
Yeah.
Even if I maybe am not always the most confident or the most eloquent, but if we don't, if not us, who? So it has to be us, because what's been going on hasn't been, we have 100 years of like, it could have been better. So it's time. Let nurses do it.
Yeah, for sure. And it's not about being the best speaker in the room. Like, patients don't really care. What they care about is what you were doing, going back and almost giving them like a whole slideshow presentation of, because they want to understand, like patients are intelligent. Patients want to know what's going on in their body, with their care. They don't want to be ignorant, but a lot of times that intimidation, the medical intimidation, puts them at the very back seat. They're like in the trunk of their own health care. When I worked in home care, I was so surprised at how many patients would tell me, I don't know what that is. Like, I don't know what medication I'm taking. I'm like, who doesn't know what they're taking? You take it every day. And I just thought it was so wild. And I would sit there and go tablet by tablet and bottle by bottle and explain, like, this is what this does. And I know, they're not absorbing all the information. So you sort of have to make it very bite-sized, But it was wild to me that patients didn't understand their own care. They didn't know what was going on. They didn't know what the name of the disease that they had was. And so that's the power, again, of nursing education, bringing that kind of highfalutin information and making it very simplified. That's the way healthcare is going to advance, when patients are better, when patients understand their care and can take care of themselves and be in the driver's seat of their own care.
Yeah, I'm hoping with Ask the Brain Nurse that we are able to create a platform that they're able to listen to and say, okay, well, these nurses know what they're talking about, and now I do too. Yes. And so I'm going to be able to go to my provider and say, I heard Katie say this, and I, and go with a level of confidence to advocate appropriately for themselves.
Absolutely. Win-win situation for the patient and then for the nurse, because it builds trust, right, in our profession. So speaking of building trust and kind of perception about nurses, let's move into our media segment. I really enjoy talking to you about neuroscience and just smiling with you. Gosh, your smile is beautiful. I can't look at you. But I want to talk about your thoughts. If you are a TV watcher, if you've been in the past, what are your thoughts about how nurses are portrayed in media?
I will admit, I'm not a big TV watcher. I'm not a big movie watcher, which does not mean that like I read books all the time. I watch like random docuseries of things. Yeah. But my probably favorite representation of a nurse on TV, and this might be a little bit older of a reference, is Scrubs.
Everyone says that.
Oh gosh, I think it's like
comedy.
It's gotta be like one of the few like
Yeah.
really accurate representations.
Yeah.
It's this nurse that like knows what she's doing and isn't afraid of
Hmm.
speaking her mind and putting things out there. And I think there's obviously a lot of other nurses out there, but they're
Yeah.
not as relatable to me.
Yeah.
Like I don't do drugs on the job. I don't speak my
Right.
mind.
I'm not sexy.
Yeah, I've never seen a doctor push their own bed down to CT scan.
Yeah.
That's always been me.
Yeah.
So yeah,
Right.
so to me, it like that is when I was kind of growing up, or whatever, when I was in nursing
Yeah.
school, Scrubs was on, and I was like, yeah, all right, I can
Ready.
be a nurse.
Yeah.
I can do
Yeah.
this.
Yeah. 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 Thank you so much. So
Mhm.
let's play our game now. Here we go.
Get me a
This
good one.
my fun jar. I love this jar so much.
Mhm.
So let's play our game. I'm going to pick a category, a genre from here, and you have to come up with the script for something, a reality show or whatever I pick out that features a protagonist, a nurse in the lead of that show. Okay, ready?
There's such
Ready,
good every
Katie?
show. I'm ready. I'm ready.
I mean, the only thing is I don't have neuroscience as one of my categories.
Oh,
That would have been awesome.
next time. I can't wait for like a cardiac nurse to come in and be like, neuroscience.
All right, this is cool.
Okay.
Your category is romance.
Okay. As a self-disclosed, I don't watch a lot of TV.
Okay.
I definitely don't watch a lot of Hallmark Channel, but that is where my first romance goes to. And so my thought is a nurse obviously has to go home for the holidays. She had just broken up with her boyfriend in the big city. And so she goes home and her, ex high school sweetheart is there. And he played a lot of football in high school.
Mhm.
And he now has continuous headaches and trouble concentrating, and she is able to help him get appropriately treated and into some neurocog for some concussion treatment.
I
And then
love
they
that.
obviously fall in love. And
You were like, I'm going to talk neuroscience and then just say
yeah,
something at the
yeah,
end that's
yeah, just squeeze it in at the
romantic.
end.
That's so hilarious. Thank you for sharing that. Whenever I do these, I always feel like I don't want people to be so like pigeonholed and like, oh, it has to be a nurse running on a hospital and do. So I love that you brought the Hallmark angle to it because she's not in a
So,
hospital, but she's still using her nursing skills.
yeah,
Very cool. Very
yeah.
cool. I love
As a
it.
nurse, we are always nurses. I
Yes.
got a call right before this that my sister has a thing and she has a question and a thing, and it
Yeah.
was,
Oh,
you're
yeah.
always a nurse no matter where you
Always.
go. So,
Absolutely.
yeah,
That's true.
you're,
Where can people find you to connect with you?
yeah. So we have a website, askthebrainnurse.com. You can find us on Facebook or Instagram at Ask the Brain Nurse. So definitely look us up, like, share, follow. We would love some support. And if you have any content ideas that you're interested in, we are always open for suggestions.
Awesome. Thank you so much for being here. Thank you for being my guest. You are proof that nursing is both an art and a science. And, when we combine the two, we can elevate the entire profession. And thank you guys for tuning in today. Thank you for watching. Please like, share, and subscribe. And always remember to go boldly and go purposefully. I'll catch you in the next one. Bye-bye. Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.